All right, let's dive right into a question that I know puzzles so many people, the super unpredictable nature of joint pain.
You know the feeling, right? One morning you wake up, you feel pretty good, and then the next day it's a completely different story. It is such a frustrating cycle, but what if I told you there's actually a clear logic behind all that chaos? Well, let's find it.
To solve this mystery, we've got to think like detectives. It turns out this fluctuating pain isn't just one thing. Nope, it's actually a tale of two totally distinct patterns. And we're about to investigate our first suspect right now. Okay, our first suspect is known as the inflammatory pattern. This is the culprit behind pain that really seems to have a mind of its own. And its origins, well, they're deep inside your body's own defense system. You see this pattern a lot in autoimmune conditions, like rheumatoid arthritis. In simple terms, your body's immune system kind of gets its wires crossed. It gets confused and starts attacking your own healthy joint tissue. And that is what creates these intense cycles of inflammation, followed by periods of calm, which we call remission. A really great way to picture this is to think of a faulty alarm system inside your body. It just keeps triggering this massive response for absolutely no good reason. That response, that's inflammation. And this suspect, it leaves behind a very specific set of clues. We're talking about joints that feel warm and swollen, morning stiffness that just hangs around for a long time, and pain that comes and goes in waves or flares. And it's all driven by that haywire immune activity. This whole up and down experience has a name. It's called the flare-remission pattern. One day, the alarm system is blaring. That's a flare. The next day, it's quiet. That's remission. And that right there is why the pain is so frustratingly unpredictable. But what if the pain isn't caused by a faulty internal alarm? Well, that brings us to our second suspect, which operates in a completely different way. This is the degenerative pattern. Now, this pattern is the hallmark of osteoarthritis. And unlike our first suspect, this isn't about a confused immune system. This is purely mechanical. It's about the physical wear and tear on the cartilage, that protective cushion inside our joints. Imagine the tread on your car's tires. Over thousands and thousands of miles, it gradually wears down. The same kind of thing happens with our cartilage over a lifetime of use. So the pain from this pattern is directly related to that physical process of wear and tear. The footprint for this suspect is tied directly to activity. The pain gets worse when you use the joint, and it feels better when you rest it. And yeah, there might be some morning stiffness, but it's usually brief. Nothing like the long-lasting stiffness of that inflammatory pattern. But here is where things get interesting, a real plot twist. If this is all about wear and tear getting progressively worse, how is it possible for severe advanced arthritis to actually hurt less? The answer, amazingly, is yes. It seems completely counterintuitive, I know, but in the very late stages of osteoarthritis, the pain can paradoxically start to lessen. So how is this possible? There are two main reasons. First, as the joint structure wears all the way down, it can become less innervated, which just means there are fewer nerve endings left to send pain signals. And second, the chronic inflammation that was present can also start to subside over time. Pretty wild, right? All right, we've investigated both of our suspects and we've uncovered their methods. So now it's time for the showdown. Let's put their patterns side by side so we can really see the difference. Okay, let's put it all together. The inflammatory pattern is defined by that long morning stiffness and those unpredictable flares where joints can get warm and swollen. The degenerative pattern, on the other hand, is marked by brief stiffness and pain that's tied directly to activity, with that strange possibility that pain can decrease in the late stages. Understanding these two distinct patterns, that solves the mystery of why joint pain feels so different from one day to the next. So we've cracked the case. But how do you use this information? Let's distill it down into a simple, field-ready takeaway that you can actually remember. Let's break this down into a super simple checklist. All you have to do is focus on two key sets of clues. Here it is, cracking the code. Step 1. Look for those inflammatory clues. Is the pain fluctuating, and is it associated with long stiffness and warmth? Or, step 2, are you seeing degenerative clues? Is the pain clearly linked to activity with only short stiffness? This two-step process is the key. And one final, crucial piece of the puzzle. Regardless of the pattern, when a treatment works, it's almost always because it has successfully reduced inflammation. This just shows you how central inflammation is to the experience of joint pain, no matter what the source is. So now you have the tools to be a detective for your own body, to spot the patterns and understand the language of joint pain. This leaves us with a final thought. Now that you can spot the pattern, what's the next step in understanding your own health journey?